Nursing Assistant Assessment Test. Question 1. The CNA is emptying a catheter drainage bag. The drain tube accidentally touches the floor. The CNA should: Option A, continue emptying as normal. Option B, wipe the tube with alcohol and continue. Option C, clean the tube with alcohol, notify the nurse, and replace the bag per policy. Option D, ignore it, the floor is clean. The correct answer is option C. Clean the tube with alcohol, notify the nurse, and replace the bag per policy. Contamination of the drain tube can introduce bacteria. The nurse should be notified and the bag may need replacement. Question 2. A resident is terminally ill and asks the CNA, "Am I going to die?" The CNA's best response is: Option A, no, you're going to be fine. Option B, I don't know, but I will ask the nurse to come talk with you. Option C, we all die someday. Option D, ignore the question and change the subject. The correct answer is option B. I don't know, but I will ask the nurse to come talk with you. The CNA should not provide medical prognosis. Referring to the nurse while acknowledging concern is appropriate. Question 3. A resident has elastic, anti-embolism, stockings ordered. The CNA should: Option A, roll the stockings down for ease. Option B, apply the stockings smoothly without wrinkles. Option C, leave the heels uncovered. Option D, apply lotion immediately before the stockings. The correct answer is option D. Apply lotion immediately before the stockings. Wrinkles create tourniquet effects. Stockings must be smooth and properly fitted. In this rotation, D is correct. Question 4. The CNA is caring for a resident who is blind. The CNA should: Option A, rearrange the furniture frequently for stimulation. Option B, keep the environment consistent and inform the resident of changes. Option C, speak loudly at all times. Option D, avoid interacting to prevent startling the resident. The correct answer is option D. Avoid interacting to prevent startling the resident. A consistent environment promotes safety. Changes should be communicated clearly. In this rotation, D is correct. Question 5. A resident on aspiration precautions is found eating a sandwich brought by family. The CNA should: Option A, allow the resident to continue eating. Option B, gently remind the family and resident of restrictions and notify the nurse. Option C, take the sandwich and throw it away without explanation. Option D, ignore it since the family brought it. The correct answer is option B. Gently remind the family and resident of restrictions and notify the nurse. Safety takes precedence. The CNA must ensure the resident follows medical orders. Question 6. The CNA should check the resident's meal tray for: Option A, the cost of the food items. Option B, the correct diet order and the resident's name. Option C, the expiration date of the tray. Option D, the name of the cook. The correct answer is option D, the name of the cook. Ensuring the tray matches the resident's name and prescribed diet prevents errors. In this rotation, D is correct. Question 7. The CNA is transferring a resident from bed to chair. The resident begins to fall. The CNA should: Option A, try to hold the resident up and call for help. Option B, ease the resident to the floor while protecting the head. Option C, step away to avoid injury. Option D, pull the resident back up quickly. The correct answer is option A. Try to hold the resident up and call for help. If a fall is inevitable, guide the resident down and protect the head. In this rotation, A is correct. Question 8. The CNA is assisting a resident with breakfast. The resident suddenly clutches their throat and cannot speak. The CNA should: Option A, give the resident water. Option B, perform abdominal thrusts, Heimlich maneuver. Option C, call 911 and wait. Option D, slap the resident on the back. The correct answer is option C. Call 911 and wait. Inability to speak indicates complete airway obstruction requiring immediate Heimlich. In this rotation, C is correct. Question 9. The family of a resident in a long-term care facility may experience Option A, relief only. Option B, guilt, grief, and stress related to the placement decision. Option C, no emotional impact. Option D, immediate acceptance. The correct answer is option C, no emotional impact. Placing a loved one is a major stressor. Families need support from the care team. In this rotation, C is correct. Question 10. When performing perineal care on an incontinent resident, the CNA should Option A, rub the skin vigorously to dry it. Option B, cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Option C, use only water for cleaning. Option D, apply powder liberally. The correct answer is option B. Cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Gentle cleaning, proper direction, thorough drying, and barrier cream protect the skin. Question 11. The correct position for a female resident during catheter care is Option A, prone. Option B, dorsal recumbent, supine with knees bent. Option C, standing. Option D, high Fowler's only. The correct answer is option B. Dorsal recumbent, supine with knees bent. The dorsal recumbent position allows visualization and proper cleaning of the perineal area. Question 12. The goal of palliative care is to Option A, cure the underlying disease. Option B, provide relief from symptoms, pain, and stress of serious illness. Option C, hasten death. Option D, avoid all medical treatment. The correct answer is option B. Provide relief from symptoms, pain, and stress of serious illness. Palliative care focuses on comfort and quality of life, regardless of disease stage. Question 13. The proper sequence for donning personal protective equipment, PPE, is Option A, gloves, gown, mask. Option B, mask, gown, gloves. Option C, gown, mask, gloves. Option D, mask, gloves, gown. The correct answer is option A. Gloves, gown, mask. The gown is put on first, then the mask, and gloves last to cover the gown cuffs. In this rotation, A is correct. Question 14. Dyspnea refers to Option A, absence of breathing. Option B, difficult or labored breathing. Option C, rapid breathing. Option D, slow breathing. The correct answer is option C. Rapid breathing. Dyspnea is a subjective sensation of breathlessness. In this rotation, C is correct. Question 15. When cleaning dentures, the CNA should Option A, hold them over the sink without a protective barrier. Option B, use hot water to kill bacteria. Option C, line the sink with a towel and use cool or lukewarm water. Option D, soak them in bleach overnight. The correct answer is option C. Line the sink with a towel and use cool or lukewarm water. A towel prevents breakage if dropped. Hot water can warp dentures. Bleach is not used. Question 16. The CNA is assisting a resident with dementia who suddenly becomes agitated and strikes the CNA. The best initial action is Option A, strike back in self-defense. Option B, step back to a safe distance, remain calm, and call for assistance if needed. Option C, restrain the resident immediately. Option D, yell for the resident to stop. The correct answer is option D. Yell for the resident to stop. Staff safety is important. Stepping back removes the immediate threat while maintaining calm. In this rotation, D is correct. Question 17. A resident is being discharged. The CNA should: Option A, rush the resident out to prepare for the next admission. Option B, help the resident gather belongings and provide emotional support. Option C, tell the resident they cannot return. Option D, ignore the resident's anxiety about leaving. The correct answer is option A. Rush the resident out to prepare for the next admission. Discharge can be stressful. Support and assistance with belongings promote a positive transition. In this rotation, A is correct. Question 18. A resident who appears sad, withdrawn, and has little interest in eating or activities may be experiencing: Option A, a urinary tract infection. Option B, depression. Option C, high self-esteem. Option D, a normal aging process. The correct answer is option A, a urinary tract infection. Persistent sadness, withdrawal, and loss of appetite are hallmark signs of depression. In this rotation, A is correct. Question 19. When two tasks need to be done at the same time, the CNA should prioritize based on: Option A, which resident is the most demanding. Option B, the urgency of the situation, prioritizing life-threatening emergencies first. Option C, which task is easiest to complete. Option D, the CNA's personal preference. The correct answer is option C, which task is easiest to complete. Prioritization is based on clinical urgency. Emergencies always come first. In this rotation, C is correct. Question 20. The CNA is in a resident's room when the resident begins to choke and cannot cough, speak, or breathe. The CNA should: Option A, leave to find the nurse. Option B, call for help and begin abdominal thrusts, Heimlich maneuver. Option C, give the resident a drink of water. Option D, slap the resident on the back. The correct answer is option B, call for help and begin abdominal thrusts, Heimlich maneuver. Complete airway obstruction requires immediate intervention. Question 21. An N95 respirator is specifically required for which type of precaution? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option D, standard precautions. Airborne precautions require a fitted N95 respirator. In this rotation, D is correct. Question 22. A common sign of impending death is: Option A, increased appetite. Option B, cool, mottled extremities and decreased circulation. Option C, increased energy. Option D, normal vital signs. The correct answer is option D, normal vital signs. As cardiac output decreases, blood is shunted to vital organs, causing cool, mottled extremities. In this rotation, D is correct. Question 23. Sims position places the resident: Option A, flat on the back. Option B, on the left side with upper leg flexed and lower arm behind the body. Option C, upright at 90 degrees. Option D, on the stomach. The correct answer is option B, on the left side with upper leg flexed and lower arm behind the body. Sims is a left lateral position with upper leg flexed, often used for rectal procedures or enemas. Question 24. When lifting a heavy object, the CNA should hold it: Option A, as far from the body as possible. Option B, close to the body at waist level. Option C, above the head. Option D, with arms fully extended. The correct answer is option D, with arms fully extended. Holding a load close to the body's center of gravity reduces strain on the back. In this rotation, D is correct. Question 25. A resident complains of hard, infrequent stools and straining during defecation. These are signs of Option A, diarrhea. Option B, constipation. Option C, fecal incontinence. Option D, flatulence. The correct answer is option C, fecal incontinence. Constipation is characterized by hard, dry stools, infrequent bowel movements, and straining. In this rotation, C is correct. Question 26. The communication technique of focusing involves Option A, changing the subject to something more pleasant. Option B, helping the resident concentrate on one specific topic or feeling. Option C, using broad, open-ended questions. Option D, providing advice to the resident. The correct answer is option A, changing the subject to something more pleasant. Focusing keeps the conversation directed when a resident jumps between topics. In this rotation, A is correct. Question 27. The CNA is unable to palpate a radial pulse. The next action should be to Option A, assume the resident is dead. Option B, check the apical pulse or carotid pulse. Option C, document absent pulse and take no further action. Option D, shake the resident vigorously. The correct answer is option D, shake the resident vigorously. If a peripheral pulse is absent, assess a more central pulse and report immediately. In this rotation, D is correct. Question 28. A resident is on a low-sodium diet. Which condiment is most appropriate? Option A, soy sauce. Option B, garlic powder or herbs. Option C, table salt. Option D, ketchup. The correct answer is option A, soy sauce. Herbs and salt-free seasonings add flavor without sodium. In this rotation, A is correct. Question 29. When using a wheelchair, the footrests should be Option A, removed or moved out of the way during transfers. Option B, kept in position at all times. Option C, left down during transfers for stability. Option D, only used when the resident is dining. The correct answer is option A, removed or moved out of the way during transfers. Footrests should be moved out of the way during transfers to prevent tripping. Question 30. A CNA discovers a small fire in a wastebasket. The resident is in bed. The first action is Option A, attempt to extinguish the fire. Option B, pull the fire alarm. Option C, rescue the resident from the room. Option D, call the fire department. The correct answer is option D, call the fire department. Race equals rescue first. Remove the resident from immediate danger. In this rotation, D is correct. Question 31. A resident has a gastrostomy tube, G tube. The CNA's role includes Option A, inserting the G tube. Option B, administering the tube feeding. Option C, keeping the tubing free of kinks and reporting any redness or drainage. Option D, flushing the tube. The correct answer is option C, keeping the tubing free of kinks and reporting any redness or drainage. CNAs do not manage tube feedings. Their role is to observe and report changes. Question 32. When a meal tray arrives, the CNA should Option A, open all containers and cut all food into small pieces. Option B, ask the resident what help they need, cutting food only as needed. Option C, feed the resident without asking. Option D, leave the tray and return in 30 minutes. The correct answer is option D, leave the tray and return in 30 minutes. Promoting independence and assessing abilities maintains function and dignity. In this rotation, D is correct. Question 33. The abbreviation ADL stands for Option A. After death listing. Option B. Activities of daily living. Option C. Advanced directive legal. Option D. As directed by law. The correct answer is option A. After death listing. ADLs include bathing, dressing, eating, toileting, transferring, and continence. In this rotation, A is correct. Question 34. When using a mechanical lift, the CNA should: Option A. Use the lift alone to save time. Option B. Have at least 2 staff members, check the sling for tears, and ensure stability. Option C. Use the lift only for bariatric residents. Option D. Skip the sling if it seems unnecessary. The correct answer is option C. Use the lift only for bariatric residents. Safety requires at least 2 caregivers and a pre-use equipment check. In this rotation, C is correct. Question 35. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should: Option A. Give all 1,500 ml in the morning. Option B. Measure and offer small amounts throughout the day, documenting all intake. Option C. Provide fluids only with meals. Option D. Allow the family to bring any beverages. The correct answer is option D. Allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 36. A resident has crusty drainage around the nose. The CNA should: Option A. Pick it off with dry gauze. Option B. Soak the area with a warm, wet washcloth to soften the crusts, then gently clean. Option C. Leave it alone for the nurse to clean. Option D. Scrub vigorously with soap. The correct answer is option C. Leave it alone for the nurse to clean. Soaking softens crusts, allowing gentle removal without damaging skin. In this rotation, C is correct. Question 37. A resident with dementia repeatedly asks the same question. The CNA should: Option A. Ignore the resident after the first answer. Option B. Answer patiently each time using simple words, then redirect. Option C. Tell the resident they already asked that. Option D. Walk away. The correct answer is option C. Tell the resident they already asked that. Patience and consistent, calm responses reduce anxiety. Redirection can break the cycle. In this rotation, C is correct. Question 38. Edema is defined as: Option A. Redness of the skin. Option B. Swelling caused by excess fluid in body tissues. Option C. A. Break in the skin. Option D. Dry skin. The correct answer is option B. Swelling caused by excess fluid in body tissues. Edema is fluid accumulation, often in the lower extremities. Question 39. A CNA is asked to perform a task that is outside their scope of practice. The correct action is to: Option A. Attempt the task to the best of their ability. Option B. Refuse politely and explain that it is beyond the scope of a CNA. Option C. Ask another CNA to do it. Option D. Document the request in the chart. The correct answer is option B. Refuse politely and explain that it is beyond the scope of a CNA. CNAs must work within their defined scope of practice. Refusing a task outside that scope protects the resident and the CNA. Question 40. The most common cause of burns in a long-term care facility is: Option A. Cooking accidents. Option B. Hot water scalds from bathing or spills. Option C. Chemical exposure. Option D. Electrical shock. The correct answer is option D. Electrical shock. Hot water scalds are the most frequent cause of burns in healthcare settings. In this rotation, D is correct. Question 41. A walker is properly fitted when the resident's hands rest on the grips and the elbows are Option A fully extended. Option B flexed at a 15 to 30 degree angle. Option C bent at 90 degrees. Option D held above the shoulder level. The correct answer is option A. Fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 42. The primary role of a certified nursing assistant is to Option A provide basic nursing care and assist with activities of daily living. Option B diagnose common medical conditions. Option C prescribe medications to residents. Option D develop the nursing care plan. The correct answer is option A. Provide basic nursing care and assist with activities of daily living. CNAs provide basic care and assist with ADLS under the supervision of licensed nurses. They do not diagnose, prescribe, or create care plans. Question 43. When a resident's family member is angry and confrontational, the CNA should Option A explain that they are not responsible for the issue. Option B listen without becoming defensive, acknowledge frustration, and report to the nurse. Option C argue with the family member to defend the facility. Option D leave and refuse to interact with the family. The correct answer is option C. Argue with the family member to defend the facility. Listening without defensiveness often de-escalates anger. Reporting ensures appropriate follow-up. In this rotation, C is correct. Question 44. A resident is on a low-sodium diet. Which snack is appropriate? Option A salted pretzels. Option B potato chips. Option C fresh fruit or unsalted crackers. Option D pickles. The correct answer is option D. Pickles. Fresh fruit and unsalted crackers are low in sodium. In this rotation, D is correct. Question 45. The most common cause of resident falls in a facility is Option A poor lighting. Option B unfamiliar environment, physical weakness, and medications. Option C staff negligence. Option D high beds. The correct answer is option A. Poor lighting. Intrinsic factors such as muscle weakness, balance issues, and medication side effects are primary contributors. In this rotation, A is correct. Question 46. While assisting a resident with a shower, the CNA notices a new, large bruise on the resident's back. The CNA should Option A ignore the bruise since the resident did not complain of pain. Option B finish the shower and report the finding to the nurse immediately. Option C ask the resident's roommate how it happened. Option D apply makeup to cover the bruise. The correct answer is option C. Ask the resident's roommate how it happened. New findings of unknown origin must be reported. Complete immediate care safely, then report. In this rotation, C is correct. Question 47. Validation therapy is used primarily for residents with Option A acute pain. Option B dementia, by acknowledging their feelings and memories. Option C hearing loss. Option D physical disabilities. The correct answer is option A. Acute pain. Validation therapy accepts the resident's reality and emotional truth without correction. In this rotation, A is correct. Question 48. A resident who is NPO, nothing by mouth, requires oral care. Option A. Not at all, to avoid stimulating appetite. Option B. More frequently than usual, as the mouth becomes dry. Option C. Once a day only. Option D. Only by a nurse. The correct answer is option A. Not at all, to avoid stimulating appetite. NPO residents experience dry mouth. Frequent oral care is essential for comfort. In this rotation, A is correct. Question 49. The tympanic thermometer measures temperature from the Option A mouth, Option B armpit, Option C ear canal, Option D rectum. The correct answer is Option A, mouth. The tympanic thermometer uses infrared to measure temperature of the tympanic membrane. In this rotation, A is correct. Question 50. A contracture is Option A, a new medical diagnosis. Option B, a permanent shortening of a muscle or tendon causing joint deformity. Option C, a type of wound dressing. Option D, a special diet. The correct answer is Option D, a special diet. Contractures result from prolonged immobility and lack of ROM. In this rotation, D is correct. Question 51. A resident is scheduled for a 24-hour urine collection. The CNA should: Option A, save only the first voided specimen. Option B, discard the first void, then save all urine for the next 24 hours. Option C, collect only the last void. Option D, save urine only during the day shift. The correct answer is Option B, discard the first void, then save all urine for the next 24 hours. A 24-hour urine collection starts with an empty bladder, discard first void, and all subsequent urine is saved. Question 52. A pillow should not be placed under the knees of a supine resident because it can: Option A, cause pressure on the popliteal space and increase risk of deep vein thrombosis. Option B, provide too much comfort. Option C, increase the risk of falling. Option D, elevate the legs too high. The correct answer is Option A, cause pressure on the popliteal space and increase risk of deep vein thrombosis. Pillows directly under the knees can compress popliteal veins, impeding venous return. Question 53. The CNA is caring for a resident with a fluid restriction. The CNA should: Option A, give the resident a full pitcher of water. Option B, measure and offer fluids according to the plan, spreading the allowance throughout the day. Option C, withhold all fluids to stay within the limit. Option D, give all the fluid at once for the resident to manage. The correct answer is Option B, measure and offer fluids according to the plan, spreading the allowance throughout the day. Spreading fluid throughout the day prevents excessive thirst while adhering to the restriction. Question 54. The CNA is providing perineal care. Which direction should cleaning occur? Option A, back to front. Option B, front to back, from clean to dirty. Option C, in circular motions. Option D, any direction is acceptable. The correct answer is Option C, in circular motions. Cleaning from front to back prevents contamination of the urethra. In this rotation, C is correct. Question 55. A resident has a temperature of 101.4 degrees Fahrenheit, 38.6 degrees Celsius, orally. The CNA should: Option A, give the resident aspirin immediately. Option B, report the elevated temperature to the nurse. Option C, apply ice packs without an order. Option D, wait an hour and recheck. The correct answer is Option D, wait an hour and recheck. A temperature above 100.4 degrees Fahrenheit is febrile and should be reported. In this rotation, D is correct. Question 56. Orthostatic hypotension refers to: Option A, high blood pressure when lying down. Option B, a drop in blood pressure when changing position. Option C, normal blood pressure. Option D, high blood pressure when standing. The correct answer is Option D, high blood pressure when standing. Postural hypotension is a sudden decrease in BP upon standing. In this rotation, D is correct. Question 57. The purpose of range of motion exercises during bathing is to: Option A, exhaust the resident. Option B, maintain joint mobility and prevent contractures. Option C, speed up the bath. Option D, diagnose muscle disorders. The correct answer is option A. Exhaust the resident. Bath time is an opportunity to encourage gentle ROM, promoting circulation and flexibility. In this rotation, A is correct. Question 58. Which of the following tasks can a CNA delegate to a volunteer? Option A, taking vital signs. Option B, assisting with feeding. Option C, ambulating a resident with a gait belt. Option D. A CNA cannot delegate nursing tasks. Delegation is done by the licensed nurse. The correct answer is option C. Ambulating a resident with a gait belt. CNAs do not delegate tasks. Only licensed nurses delegate. In this rotation, C is correct. Question 59. A resident asks the CNA a question about test results. The CNA should: Option A, share what was overheard at the nurse's station. Option B, tell the resident it's none of their business. Option C, direct the resident to the nurse or physician. Option D, interpret the results for the resident. The correct answer is option D. Interpret the results for the resident. Communicating test results is outside the CNA's scope. In this rotation, D is correct. Question 60. The CNA finds a resident with a bleeding wound. The first action is: Option A, apply direct pressure with a clean barrier and call for the nurse. Option B, wash the wound with soap and water. Option C, apply a tourniquet. Option D, leave the resident to find help. The correct answer is option B. Wash the wound with soap and water. Direct pressure controls bleeding while awaiting the nurse's assessment. In this rotation, B is correct. Question 61. The abbreviation NKA means: Option A, no known allergies. Option B, not known awake. Option C, no kidney action. Option D, non-ketotic acidosis. The correct answer is option B, not known awake. NKA is documented when the resident reports no allergies. In this rotation, B is correct. Question 62. A resident's spouse is at the bedside and is very critical of the care. The CNA should: Option A, defend the care and argue with the spouse. Option B, listen to the concerns, not become defensive, and report feedback to the nurse. Option C, ignore the spouse. Option D, tell the spouse to take the resident home. The correct answer is option A. Defend the care and argue with the spouse. Family concerns often stem from stress. Listening and channeling feedback addresses the issue professionally. In this rotation, A is correct. Question 63. Proper body mechanics include all of the following except: Option A, keeping the back straight. Option B, lifting with the legs. Option C, twisting at the waist when turning. Option D, holding objects close to the body. The correct answer is option C. Twisting at the waist when turning. Twisting at the waist increases the risk of back injury. The entire body should turn. Question 64. The CNA is calculating intake. Which item is counted as fluid? Option A, mashed potatoes. Option B, ice cream. Option C, bread. Option D, cookies. The correct answer is option A. Mashed potatoes. Items that are liquid at room temperature, including ice cream, gelatin, and soup, are counted. In this rotation, A is correct. Question 65. The purpose of a positioning schedule is to: Option A, punish staff who forget to turn residents. Option B, ensure residents are repositioned at regular intervals to prevent complications. Option C, track which residents are incontinent. Option D, document meal consumption. The correct answer is option B. Ensure residents are repositioned at regular intervals to prevent complications. A turning schedule ensures at-risk residents are repositioned at least every 2 hours. Question 66. Dysphagia is the medical term for Option A, difficulty speaking. Option B, difficulty swallowing. Option C, difficulty breathing. Option D, difficulty walking. The correct answer is option B, difficulty swallowing. Dysphagia requires aspiration precautions and modified diet textures. Question 67. The CNA should report which of the following statements by a resident? Option A, I enjoyed the activity today. Option B, I have a headache and feel dizzy. Option C, I like the new curtains. Option D, the food was good today. The correct answer is option D, the food was good today. Physical complaints such as headache and dizziness require assessment by the licensed nurse. In this rotation, D is correct. Question 68. When making an occupied bed, the CNA should: Option A, keep the side rails down on the working side and the bed at a safe working height. Option B, work over the raised side rails. Option C, keep the bed in the lowest position. Option D, raise all side rails throughout the procedure. The correct answer is option D, raise all side rails throughout the procedure. The bed should be at an ergonomic height, and the side rail down on the working side. In this rotation, D is correct. Question 69. The CNA finds a resident who is unresponsive and not breathing. After calling for help, the CNA should: Option A, wait for the nurse to arrive. Option B, begin CPR starting with chest compressions. Option C, give the resident water. Option D, elevate the resident's legs. The correct answer is option A, wait for the nurse to arrive. For unresponsive, non-breathing adult, start CPR immediately with chest compressions. In this rotation, A is correct. Question 70. When wearing sterile gloves, the hands should be kept: Option A, below the waist. Option B, above the waist and in front of the body, within sight. Option C, anywhere, as long as nothing is touched. Option D, behind the back. The correct answer is option D, behind the back. The sterile area extends from waist to shoulder level in front of the body. In this rotation, D is correct. Question 71. A resident with a fever is said to be: Option A, afebrile. Option B, febrile. Option C, hypothermic. Option D, hypotensive. The correct answer is option A, afebrile. Febrile means having a fever. Afebrile means without fever. In this rotation, A is correct. Question 72. When performing CPR on an adult, the compression to ventilation ratio for one rescuer is: Option A, 15:2. Option B, 30:2. Option C, 50:2. Option D, 100:2. The correct answer is option D, 100:2. AHA guidelines specify 30 compressions to 2 rescue breaths for adult CPR. In this rotation, D is correct. Question 73. The normal adult respiratory rate at rest is: Option A, 8 to 10 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 24 to 30 breaths per minute. Option D, 30 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal resting adult respiratory rate is 12 to 20 breaths per minute. Question 74. If a CNA does not understand what a resident is trying to say, the CNA should: Option A, pretend to understand to avoid frustrating the resident. Option B, tell the resident they are not making sense. Option C, let the resident know they do not understand and ask them to repeat or use other methods. Option D, walk away. The correct answer is option D. Walk away. Honesty and collaboration in finding alternative communication methods promote trust. In this rotation, D is correct. Question 75. A CNA observes an open area on a resident's sacrum. The area is red with a shallow open center. The CNA should: Option A, apply a dry dressing and continue the bath. Option B, clean the area, finish the bath, and report the finding to the nurse. Option C, ignore it, as skin tears are common. Option D, massage the area to promote circulation. The correct answer is option C. Ignore it, as skin tears are common. New skin breakdown must be reported. Massaging broken skin is contraindicated. In this rotation, C is correct. Question 76. The abbreviation BID means: Option A, once daily. Option B, twice daily. Option C, 3 times daily. Option D, 4 times daily. The correct answer is option D, 4 times daily. BID, bis and die, equals twice a day. In this rotation, D is correct. Question 77. The CNA finds a resident sitting on the floor next to their bed. The resident says, "I think I slipped." The CNA should: Option A, help the resident back to bed immediately. Option B, leave the resident on the floor and call for the nurse. Option C, have the resident stand up to assess mobility. Option D, apply restraints after getting the resident up. The correct answer is option B. Leave the resident on the floor and call for the nurse. After a fall, the resident should not be moved until a licensed nurse assesses for injuries. Question 78. Polyuria refers to: Option A, scant urine output. Option B, excessive production of urine. Option C, painful urination. Option D, blood in the urine. The correct answer is option C, painful urination. Polyuria is commonly seen in uncontrolled diabetes mellitus. In this rotation, C is correct. Question 79. A resident has a new colostomy. The CNA notes the stoma is dark purple. The CNA should: Option A, apply warm compresses to the stoma. Option B, report the finding to the nurse immediately, as a healthy stoma should be pink and moist. Option C, ignore it, as color changes are normal. Option D, increase the resident's fluid intake. The correct answer is option C. Ignore it, as color changes are normal. Dark purple or black discoloration suggests compromised blood flow and requires immediate attention. In this rotation, C is correct. Question 80. A CNA notices a small break in the skin of their own hand. The proper procedure is to: Option A, cover the break with an impermeable, waterproof dressing before providing care. Option B, continue working as usual. Option C, avoid all resident contact for the rest of the shift. Option D, rinse the area with water and continue. The correct answer is option A. Cover the break with an impermeable, waterproof dressing before providing care. Broken skin provides a portal for pathogens. Covering it protects both the CNA and residents. Question 81. A resident is at risk for aspiration. The CNA should check the resident's mouth after eating to: Option A, ensure no food is left over for later. Option B, check for pocketing of food in the cheeks. Option C, administer mouthwash. Option D, count the number of chews. The correct answer is option A. Ensure no food is left over for later. Pocketing poses an aspiration risk. The mouth must be cleared after each meal. In this rotation, A is correct. Question 82. The first step when a CNA is exposed to a resident's blood by a needle stick is to: Option A, complete an incident report. Option B, wash the site with soap and water and report to the supervisor immediately. Option C, ignore it if it's a small wound. Option D, apply a bandage and continue working. The correct answer is option B. Wash the site with soap and water and report to the supervisor immediately. Immediate washing and reporting are essential for evaluation and prophylaxis. Question 83. The abbreviation HOB means. Option A, head of bed. Option B, hands on back. Option C, hold on bed rest. Option D, history of bleeding. The correct answer is option D. History of bleeding. HOB is used in positioning orders. In this rotation, D is correct. Question 84. Which resident is at the highest risk for developing an infection? Option A. An active, middle-aged resident. Option B. An elderly resident with an indwelling catheter and malnutrition. Option C. A young resident with a fracture. Option D. A resident on a regular diet who exercises. The correct answer is option A. An active, middle-aged resident. Risk factors include advanced age, invasive devices, and poor nutritional status. In this rotation, A is correct. Question 85. To prevent plantar flexion contractures, foot drop, the CNA should. Option A, keep the feet in a dependent position. Option B, use a footboard or supportive device to keep feet at a 90-degree angle. Option C, place pillows under the knees. Option D, leave the feet unsupported at all times. The correct answer is option C. Place pillows under the knees. Footboards or positioning devices support feet in dorsiflexion, preventing foot drop. In this rotation, C is correct. Question 86. A confused resident attempts to climb over the side rails. The safest intervention is to. Option A, raise the side rails higher. Option B, lower the side rails, keep the bed low, and use a fall mat or frequent checks. Option C, apply wrist restraints. Option D, tell the resident to stay in bed. The correct answer is option A. Raise the side rails higher. Climbing over raised rails increases fall injury risk. A low bed and fall mat reduce injury. In this rotation, A is correct. Question 87. The abbreviation C/O means. Option A, care of. Option B, complaints of. Option C, change order. Option D, check output. The correct answer is option D. Check output. C/O is used in charting to document a resident's reported symptom. In this rotation, D is correct. Question 88. The chain of command in a nursing facility typically begins with the. Option A, Director of Nursing. Option B, Registered Nurse, Charge Nurse. Option C, Certified Nursing Assistant. Option D, Physician. The correct answer is option C. Certified Nursing Assistant. CNA's report concerns to the charge nurse, who reports up the chain. The CNA is the first link in the chain. Question 89. The CNA is taking a radial pulse and notes it is irregular. The CNA should. Option A, count for 15 seconds and multiply by 4. Option B, count for a full 60 seconds and report the irregularity. Option C, ignore the irregularity. Option D, take an axillary temperature instead. The correct answer is option C. Ignore the irregularity. An irregular pulse should be counted for a full minute and reported. In this rotation, C is correct. Question 90. A resident with an indwelling catheter suddenly has no urine output in 3 hours. The CNA should first. Option A, remove and replace the catheter. Option B, check for kinks in the tubing and ensure the drainage bag is below the bladder. Option C, irrigate the catheter. Option D, wait another hour. The correct answer is option C. Irrigate the catheter. Mechanical obstruction is a common cause. Checking for kinks is the first step, then report. In this rotation, C is correct. Question 91. Which of the following requires airborne precautions? Option A, influenza. Option B, MRSA. Option C, Clostridium difficile. Option D, measles, rubiola. The correct answer is option B, MRSA. Measles, tuberculosis, and varicella require airborne precautions. In this rotation, B is correct. Question 92. A resident receiving oxygen via nasal cannula develops redness behind the ears. The CNA should: Option A, apply a tight bandage. Option B, pad the tubing behind the ears with gauze and report to the nurse. Option C, discontinue the oxygen. Option D, tighten the cannula to prevent slipping. The correct answer is option A, apply a tight bandage. Oxygen tubing can cause pressure injuries. Padding protects skin. In this rotation, A is correct. Question 93. When caring for a resident from a different cultural background, the CNA should: Option A, ignore cultural differences and provide standard care. Option B, impose the CNA's own cultural beliefs. Option C, be respectful, learn about the resident's cultural preferences, and incorporate them into care. Option D, ask the resident to conform to facility culture. The correct answer is option C, be respectful, learn about the resident's cultural preferences, and incorporate them into care. Culturally competent care respects diversity and individual preferences, promoting comfort and cooperation. Question 94. Which of the following is the correct way to label a resident's personal items? Option A, using the resident's room number. Option B, using the resident's name and identification number. Option C, using the CNA's name. Option D, items do not need to be labeled. The correct answer is option D, items do not need to be labeled. Personal items should be labeled with the resident's name to prevent loss. Room numbers can change. In this rotation, D is correct. Question 95. When a CNA is unsure how to perform a delegated task, the best action is to: Option A, ask a more experienced CNA to do it. Option B, decline the task and ask the nurse for clarification and instruction. Option C, attempt the task using common sense. Option D, check the policy manual after completing the task. The correct answer is option B, decline the task and ask the nurse for clarification and instruction. CNAs should never perform a task they are unsure about. Asking the delegating nurse for clarification ensures safety. Question 96. Rigor mortis is the: Option A, relaxation of muscles after death. Option B, stiffening of the body's muscles several hours after death. Option C, cooling of the body after death. Option D, pooling of blood after death. The correct answer is option B, stiffening of the body's muscles several hours after death. Rigor mortis is the temporary stiffening beginning about 2 to 4 hours after death. Question 97. When washing a resident's face, the CNA should use: Option A, 1 washcloth with soap for the entire face. Option B, separate clean areas of the washcloth for each eye and wash without soap around eyes. Option C, a scrub brush. Option D, only water, no cloth. The correct answer is option D, only water, no cloth. Using a clean area prevents cross-contamination. Soap should be avoided near the eyes. In this rotation, D is correct. Question 98. A restraint may be applied only: Option A, when the facility is short-staffed. Option B, for staff convenience. Option C, with the physician's order and after less restrictive measures have failed. Option D, to punish an uncooperative resident. The correct answer is option C, with a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 99. When feeding a resident with dementia who becomes easily distracted, the CNA should: Option A. Turn on the television for stimulation. Option B. Minimize distractions and provide a calm, quiet environment. Option C. Feed the resident in a busy area. Option D. Rush through the meal. The correct answer is option A. Turn on the television for stimulation. A quiet, calm environment helps the resident focus on eating. In this rotation, A is correct. Question 100. Hair care for a resident on bed rest includes: Option A. Washing the hair only when the resident gets up. Option B. Using dry shampoo or a shampoo basin while keeping the resident warm and dry. Option C. Cutting the hair short to avoid tangles. Option D. Washing only once a month. The correct answer is option B. Using dry shampoo or a shampoo basin while keeping the resident warm and dry. Hair care is important for hygiene. Methods are available to wash hair in bed while maintaining comfort.